She's like a new baby when she came here, honestly.
It's definitely more hands-on, and they can show you step by step how to do everything.
The nurses, anytime I called, anytime I had a question, I didn't feel stupid for, like it was a stupid question.
The chaos of intensive care versus the relaxed setting here is what really has been a valuable thing for us.
So to come here and have these people care for them like I care for them was a blessing.
For more than 25 years, children and families have benefited from the unique healthcare services provided by the Children's Home. Now, with the assistance of the Mario Lemieux Foundation, a new building specially designed for family-based care is available in close proximity to the Pittsburgh region's hospitals. The Children's Home and Lemieux Family Center is an independent, licensed pediatric specialty hospital. It is designed with infant and pediatric units to meet the needs of infants, children, and their families when they are ready to transition from hospital to home.
Coming here allows us to actually shorten the overall time from admission to discharge to home by giving an intensive period of education to the families, an environment that's conducive to learning, but also nurturing and comforting to the families and the children.
We should forget about the ICU setting now and concentrate on the developmental issues of the baby, but also concentrate on the interaction between the baby and the family.
In addition to quality medical care, there's also support, social service support, developmental support for the children so that it allows the families to learn how to care for their infants before they go home.
Oh, thank you for everything. We loved you. Oh,
Many of the children who come here are here for the parents to become comfortable with a new medication, a new technology. So the child may be stable from our standpoint, but it's really the parents who need to become comfortable with a different level or different aspect of care.
This is really a very nice place, which was really good for BJ. I think anybody who has the opportunity to come here should really take advantage of it because they help you out in so many ways. And they comfort you mentally. Mentally, I was pleased. I was really burnt out, and when I came here, they just put everything at ease.
Having a sick child is one of the most stressful experiences a human being can possibly go through. The families come here and immediately I see the difference in their faces. They're more relaxed, they're better rested, and you know the world's a different place when you get a good night's sleep.
Safe and quick transports from the referring hospital are arranged in coordination with the Children's Home. A parent can ride in the ambulance or meet the child upon arrival.
The transfer is very nice. I was able to ride in the ambulance with the nurse in the back with the boys, and my husband followed. I was very nervous, but it was just smooth and just went perfect.
I think the minute you walk through the door, you see that it's a totally different place, from the people who sit at the front desk who greet you by name, to just walking onto the nurses unit and seeing that it's really not like a hospital.
The Children's Home is staffed by experienced registered nurses and nurse practitioners who have spent years working in neonatal and pediatric environments.
The quality of care isn't going to change at all. The nurses are going to provide the same level of care, the same attention to detail, and the physicians are just as available here.
The same group of physicians who oversaw the care of your child at your referring hospital will oversee his or her care at the Children's Home during daily rounds.
The setting is fantastic. The level of noise here is incredibly low. It's quiet, it's perfect for the babies, and for the developmentalists to work with those babies and get them a step closer to home.
The nursery setting is calm and quiet. Crib spaces are grouped in small clusters that allow families the choice of privacy or interaction with nurses and other parents. Natural light helps infants to adjust to day-night cycles to help prepare them for life outside the hospital.
ICU, there's a lot more commotion, too much noise. Babies really don't get sleep. She had her days and nights mixed up. Here it's a lot peaceful. We actually got her on a schedule now. She goes to sleep all night and wakes up during the day.
The environment in the pediatric unit is more vibrant. Children who are medically able can leave their bedrooms and interact in the play area under nurse supervision, or receive their occupational and physical therapy.
The nursing staff has been very attentive. They've been really good about keeping an eye on this one and helping us keep her out of trouble.
What a neat thing that I can have a child who might ordinarily be spending months in an intensive care unit, in a place that looks like a child's bedroom, and yet set up with a ventilator and whatever machinery we need